welcome all of you. Ruminal lactic acidosis is a clinical emergency. It can kill affected goat or sheep in about 6 to 8 hours time after consumption of fermentable carbohydrate. So that is the emergency at which you have to start the treatment in right direction to save the life of the animal. So what are the, basically all of us, we know that the ruminant digestive system is designed to digest complex carbohydrates, whereas sometimes if they are exposed to highly fermentable carbohydrate, this fermentable carbohydrate get converted into lactic acid, and this lactic acid destroys the rumen ecosystem, and then it creates such a pathetic situation that even it kills the host if it is not treated in time. So we have to see what are the possible carbohydrate sources which can induce lactic acidosis. So cereal grains like rice, wheat, millet, jowar, I purposefully listed them in descending order. Rice forms the top of the list of carbohydrate which can ferment very rapidly and cause a very severe acidosis in case of ruminants, including sheep and goat and cattle. Wheat follows next, then the millet and jowar. So jowar is least possibly associated with ruminal lactic acidosis. Then along with cereal grains, the spoiled rotten fruits from vegetable market can also be a very potent source of carbohydrates. Okay, and you can see that most of times the vegetables which are, especially the fruits which are rotten in the vegetable market, they are dumped in the nearest dustbin so that the animals, they have access and then they can eat it and can end up into a severe lactic acidosis. Leftover edible waste carbohydrate rich food like rice, chapatis during social gatherings. We can see the marriages, then some of the social festivals in the villages where food is prepared for a larger gathering, and by some means, in case if the audience doesn't turn up or the people, they don't turn up in the expected numbers, so much of the food is wasted, and this waste food again it goes back to the dust, nearing to the dustbin, and these poor animals, they have access and can end up into a severe lactic acidosis. Crushed sugar cane after extraction of cane juice can also be a source if they are eaten in larger quantities. Okay, so cane juice is very much available during summer, so people, they enjoy the cane sugar juice in the small shops which are everywhere, but nobody thinks about what to do with the crushed sugar cane. And these crushed sugar canes, if they are left unattended, they can be a source of carbohydrate and can end up into a severe acidity. Now, how much of carbohydrate is responsible for inducing lactic acidosis? This is a topic of lot of discussion, because when I was working as assistant professor and I used to take the clinical students for clinical training in the nearby district hospital, every alternate day, a goat used to be presented with acute carbohydrate engorgement. And in spite of whatever possible treatment which we were trying, some of the animals, they were dying because of the condition. The literature used to say that about 90 to 120 grams of carbohydrate substrate is required to induce acute ruminal acidosis. Now, even if you take 100 grams per kg body weight as a, the therapeutic dose, so I used to imagine 100 grams per day means for a goat, 100 into 30 kgs, for example, means a goat should eat at least 3 kgs of available carbohydrate to end up into a death-like situation in acute carbohydrate engorgement. But when we used to collect the history, when the case is presented to our hospital, we used to get surprised that owner used to show a very small quantity. So this much of carbohydrate has been eaten by this animal, and this is the pathetic situation of the animal. So I just wanted to know whether in any low doses are also responsible for acute lactic acidosis. And that made me to do the little bit of experimentation. And I started with a lower dose, and then I tried to search. So I got a paper published in 1952 by, there are so many papers are there, old papers if you go through, they say that the carbohydrate substrate and the ruminal lactic acidosis, they have got so much of intricacies. So what it is that, see, if the animal is exposed to available carbohydrate regularly, his microflora get adjusted to that. So a larger dose is required to induce acute lactic acidosis in goats or in any ruminant animal, because it has been adapted to that. You can see in Western countries, the grain is a routine diet for their, along with the roughages, grain is a routine diet for beef cattle. But hardly a beef cattle dies because of lactic acid. It is because of conditioning. Slowly, the animal is conditioned so that the carbohydrate resistance or the microflora in the rumen, they get acquainted to the carbohydrate source, and not much of the lactic acid is produced, and it doesn't develop lactic acid. Whereas the situation is different in Indian scenario. These poor, goats which normally go for grazing, but in urban setup, when they don't have grazing lands, they just go here and there in the market. They just go nearby the households, and whatever the carbohydrate source is available, they just try to eat up just to fill their stomach, isn't it? So these goats which are wandering here and there, they are not adapted to the carbohydrate. So even lower dose of carbohydrate can also induce lactic acid. So my paper, way back immediately after PhD, I was the first person to report that as low as 40 grams of carbohydrate substrate can induce a life-threatening lactic acidosis in case of goats. Okay, so 40 grams, you can imagine a 30 kg goats means around 1200, means 1.2 kgs. 1.2 kgs is a very small quantity to induce lactic acidosis. So my paper says that even 40 grams of carbohydrate substrate can also induce a life-threatening lactic acidosis in a goat which is not adapted to carbohydrate. Several papers which say that what is the type of carbohydrate which can induce acute lactic acidosis. Now, many of the papers, they say that the particle size of carbohydrate plays an important role. Smaller the particle size, it is more fermentable, it is more accessible to the rumen microflora to act on and to produce lactic acid more rapidly. So finer powders, here you can see the crushed grains, soaked grains, then flour, rice flour, wheat flour, they are more toxic than the whole grain, because whole grain requires little more time to open up and expose the carbohydrate inside. Whereas the crushed or soaked or flour, cereal flours, they are more toxic than the whole grains. Then I have already explained you, theoretically a goat weighing around 30 kg require about 1.2 to 3.6 grams of carbohydrates. This 1.2 kgs to 3.6 kgs of carbohydrates to end up into a life-threatening like situation. Now, what happens when the carbohydrate is ingested by a ruminant animal? So once it is ingested, the carbohydrate source is open, and all of us, we know that the rumen environment is measured, or majority of the organisms which are in the rumen, they are gram negative. 80% or 85% of the rumen microflora, they are gram negative, and hardly 10 to 15% microflora, they are gram positive. Along with that, protozoa are also there, small, medium, large size protozoa. But we are talking about the microorganism, that is bacteria, gram negative and gram positive. So in a normal rumen, gram negative organisms, they predominate in the rumen, and gram positive, they are in a very little quantity. But when carbohydrate substrate, which is highly fermentable, which is a good source for gram positive organisms, among them the Streptococcus bovis is a major organism which can rapidly utilize the carbohydrate and get converted into lactic acid. So it becomes functional. Streptococcus bovis, they call it as colonization, and then it engorges the whole rumen. It takes over the gram negative organisms, and gram positive Streptococcus bovis, they outnumber the gram negative organisms, and they try to bring the pH from what we call it as 6.8 to 7.2 is the normal rumen fluid pH range. So they bring it to 5.5. So when the pH ranges or pH reaches to 5.5, one more colleague of Streptococcus bovis, that is Lactobacillus, also joins the hands of Streptococcus bovis and further try to degrade the available carbohydrate source into lactic acid. And from 5.5, they bring back the pH to 4 to 4.5. So I have, almost more than 100, 150 cases during my research. I tried to see what drop of pH. People, they say that it can go up to 3.5 or 5, something like that. But I have seen that at 4 it gets stabilized because it doesn't fall below that, because it also affects the total, the ionic balance in the bloodstream also. So between 4 to 4.5, I have recorded the dropping of rumen fluid pH. And then because of this, the essential microflora which contribute for ruminant digestion, they get destroyed. So it includes the microorganisms, that is bacteria. It includes the protozoa, which are small, medium, and large, and even some of the bacteriophages and fungi. Now, so much of research is going on, which are the essential and phytobiotic bacteria which are responsible, which are trying to incorporate the rumen digestion and making the foodstuff into energy. So all the essential microorganisms which contribute for rumen digestion, they get dead because of the drop in pH, because they cannot sustain the drop in pH. Okay, so this is the basic what you can call it as. It happens during the ruminal lactic acid. Then what next? So because of this, all the process what we have encountered, all essential microflora, they are dead. And then because of that, what happens is, now what we have understood is gram-negative bacteria, they are the one which are destroyed at first. So gram-negative bacteria, they are rich in lipopolysaccharide in their cell wall and cell membrane. And because of that, when they die, they don't die as such. So these gram-negative microflora, when they die, they release a lot of endotoxin. And that's why endotoxemia is a very distinct pathological feature of ruminal lactic acidosis. Apart from that, lactic acid being a high molecular weight molecule, it changes the osmolarity. It increases the osmolarity of rumen fluid. Because of the change in osmolarity of rumen fluid, the fluid is drained from the system and it enters into the rumen. And that's why you can find a very gross enlargement or distension of abdomen in case of lactic acidosis. That is because of the accumulation of water. From all the sources, the water is drawn into the rumen because of the lactic acid. Lactic acid being a high molecular weight molecule, it drags the fluid, it drags the water from systemic circulation and tries to create a fluid in the rumen. And that's why ruminal distension is a very distinct feature of ruminal lactic acid. And that's why we say also fluid splashing sound. Slide, if you tap the abdomen of a lactic acid acidosis case, you can find a lot of fluid accumulated in the rumen. So at one end, it causes severe what you can call a distension of abdomen because of the fluid accumulation in rumen. At the same time, systemically, it causes severe dehydration. Okay, and then one more thing which is observed in case of lactic acidosis, so much of endotoxins are there, so much of damage is there. Histamine release, because of the histamine release, the rumen contractions have stopped. It ends up into chemical rumenitis. So this lactic acidosis, lactic acid which is there in the rumen can cause chemical rumenitis, and this chemical rumenitis causes sloughing of the rumen mucosa, and that's why the endotoxins which are there in the rumen get absorbed, and because of that there is a endotoxemia. Okay, and apart from that, lactic acid is also absorbed into the systemic circulation, ending up into metabolic acidosis. Okay, so this is another part of pathogenesis of lactic acidosis in ruminants. Then what are the clinical signs? The clinical signs, they revolve around 4 or 5. I have got some beautiful pictures during my doctoral research, which I would like to share in the presentation. So the onset is very sudden. They say that in about 6 to 8 hours, the full blown ruminal lactic acidosis can be seen if the carbohydrate source is large enough and it is highly fermentable. in about 6 to 8 hours, a good goat which has gone for grazing comes back with a stumbling gait and falls down, and it is unable to stand with an acute abdominal distension. It is a distinct feature of ruminal lactic acidosis. So acute distension of abdomen, which can be very well seen, which can be palpated also, and you can see that distension is not because of, you may confuse with tympani. Little bit of gas will be there, but the distension is because of the fluid accumulation. And that's why if you tap the abdomen, if you just with your palm, if you just push the abdomen, you can even listen to fluid splashing sound, because the viscous rumen fluid, it becomes totally watery. Okay, and it is free in the rumen, and that's why you can get a fluid splashing sound. And the animal is showing severe signs of dehydration, sunken eyeballs, then skin tuger test. You can see the high values are very high. Okay, and then the animal will not be able to stand, inability to stand, ataxia, and majority of the cases they are brought to the hospital in recumbent stage. Okay, these are the distinct clinical features which are observed. Apart from that, for acute ruminal lactic acidosis, you can see so many other clinical features also. What are those? Regurgitation of rumen content. The contents are accumulated in rumen so much that sometimes they get regurgitated out, and through nostril they come out. So green rumen fluid will be oozing through nostrils. So this is also a indication of advanced stage of ruminal lactic acidosis. Elevated heart rate. Because of the endotoxemia, the heart rate will be highly increased. It may go up to 120, 130, 140 beats per minute. And this is a great indication. I will come to that topic when diagnosis, a part of the ruminal acidosis comes. Elevated heart rate is indirectly proportional, you can call it as. Elevated heart rate, if it goes beyond 120, the survival rate is very, very poor. Okay, because it has been documented that for acute lactic acidosis, if it is not treated in time, it can cause death in about half an hour to 1 hour. Okay. Tachypnea, that is respiratory distress. This is because of the compromised thoracic space. So much of distension is there. Apart from that, metabolic acidosis is there. Because of that, hyperapnea or tachypnea can be seen. Rapid respiratory breathing, respiratory reports can also be seen in a sheep or goat affected with lactic acidosis. Apparent blindness. Apparent blindness means blindness because of some ocular abnormality can be understandable. But apparent blindness means you don't find any abnormality, but in spite of that, the animal is not able to see. That can be, checked out by, they call it as blinking test, isn't it? Or what they call it as, just move your hand in front of the eyes, and you can see that the animal is not responding to your reaction. So that is apparent blindness. And pupils are dilated, unresponsive pupils, and jugular kink. The animal will not be able to bear the weight of the head. It will be putting the head on plank. That is called a jugular kink. So some of the pictures I have with me that I will be sharing with you during presentation. Here you can see so much of acute distension of abdomen is there. But in spite of that, here the gas was more in this case. That's why, and the animal was pregnant also. That's why you can see so much of distended abdomen. Okay. Here you can see from a dorsal side, the photograph has been taken, and you can see the contours on left side as well as right side. You can see the distension of abdomen very, very visible. Here you can see ataxia, or the animal is not able to bear the body weight. You can see how in a postural reaction itself says that the animal is not able to stand properly. And this was the only when I tried to do the incidents, I tried to depict in male and female. I could find that the male, they were little less susceptible, maybe because they have got a preference not to go around and eat whatever is available. And apart from that, the male ratio when compared to the female ratio is also varying. So you can find a difference in that. So this was the only male goat which I could get it in lactic acidosis. And here you can see small dribbling is there. This is greenish fluid which is coming through nostrils, and that is because the ruminal acids, as ruminal contents getting regurgitated through nostrils. Here you can see how much of difficulty the animal is facing. You can see here the distension of abdomen, the animal is not able to stand on its own. It is trying to sit on the ground. Okay. So this inability to stand, distension of abdomen, and then ataxia, these are the some of the features associated with lactic acidosis. Here you can see a goat affected with acute ruminal acidosis. You can see the contents are getting regurgitated through nostrils. Okay. So this is also a very distinct feature of acute ruminal lactic acidosis. How you are going to diagnose a case of ruminal lactic acidosis? It is, I told you, depending upon the clinical features as well as the history taking, these are the two main features which you have with you. So the owner will definitely say that I have seen the animal eating carbohydrate substrate. Apart from that, the clinical signs which are visible in the animal, like abdominal distension, fluid splashing sound in the abdomen, then the animal is not able to stand. It is more trying to prefer to be in recumbent stage. Apart from that, elevated heart rate, elevated respiratory rate, ongoing dehydration, and then in many cases you can find diarrhea or passing of mild, pestifeces is also accompanied in ruminal lactic acidosis. Apart from that, laboratory investigation, you have so many parameters which you can check it. The rumen fluid you have to collect by puncturing the left paralumbar fossa. So pH is the one which you can see. So this pH is very important, and it will guide you. It will tell you what stage of ruminal lactic acidosis the animal is suffering from. So all of us, we know that the pH ranges between 6.8 to 7.2, and it will be definitely less than that. Okay. So 6 to 7, what we call it as, it is subacute lactic acidosis, which is the mild. And most of the times the animals, they recover with a simple treatment. Whereas acute and peracute lactic acidosis, the pH is always less than 5.5. Okay. So 5.5 and less pH always says that the animal is in either acute or peracute stage of lactic acidosis. Microscopically, you have to just put a drop of rumen fluid, put a cover slip, and observe under low power. You will not find a single microflora. Most of the times, you can see the small or large or medium microprotozoa, they move around in a small, low power field. But here you will not find any microflora. Even if they are there, they are totally dead. And that can be detected by iodine test. So iodine test is nothing but the iodine reagent is there. You have to put a drop of that iodine reagent in the rumen fluid and see. So normally what happens is most of the protozoa, they eat the carbohydrate substrate or starch. They survive on starch. Okay. So what will happen is, so normally the protozoa, they are filled with the starch particle. As soon as you add the iodine reagent, the whole protozoa will take bluish to black strain. So in normal, if you want to see if the protozoa is filled with the starch or not, you can just see by putting one drop of iodine. Okay. And then iodine reagent. Right? So if it is full with the rumen, the protozoa is full with carbohydrate substrate or starch, it means it is active, it is participating in rumen digestion. Whereas in case of lactic acidosis, all these dead protozoa, they will take a fine ream of blue color or black color at the periphery, and you do not find any starch material inside the protozoa. So that indicates that these are the dead protozoa and they are not contributing at all in the ruminant digestion. Okay, so that is what in microscope you have to observe. Then these are the two advanced laboratory tests which can also be performed if you have got a good laboratory support. They call it as MBRT. MBRT is nothing but the methylene blue reduction test. So it is a 0.3%, 0.3% methylene blue. Or 3 drops of this methylene blue reagent, you have to add in about 10 ml of rumen fluid. So it is a simple reaction, is very, very simple. What we say that the gram-negative organisms, they predominate in the rumen ecosystem. So that's why whatever fluid you have collected from rumen in normal animal, it has got enough gram-negative organisms. And these gram-negative organisms, they have a methylene blue reduction property. So as soon as you add the methylene blue reagent, these microorganisms, they reduce the methylene blue. And the blue color which appears in rumen fluid after putting 2 drops or 3 drops of methylene blue, within 3 minutes, the rumen fluid comes back to its green color. Okay, it becomes blue transitorily, and within 3 minutes, again it becomes the normal rumen fluid. So that says that the rumen fluid is rich in microorganisms which are gram negative, and they are participating in rumen digestion. Whereas in case of lactic acidosis, there are no gram negative organisms. And that's why even if you keep this test tube by adding methylene blue for hours together, the color will not change. It will remain blue only. So that is what we call as methylene blue reduction test. And then one more test, they say that sedimentation activity test. This is also a simple test. What you have to do is about 25 ml of rumen fluid in a measuring cylinder. You have to just pour it, mix it, and keep it as it is. So normally the rumen fluid has got its own properties, physical properties. Okay, that we call it as stratification activity. Stratification activity means if you keep the rumen fluid stable or on a flat surface, the rumen fluid tries to divide itself into 3 layers. The coarse particles, undigested coarse particles, they float at the top. Fine digested particles, they get up into the sediment and leaving a clear fluid in the middle. So that is what we call as stratification or sedimentation activity of normal rumen fluid. Okay, so if you keep this rumen fluid of a normal animal, within about 6 minutes or so, you can find stratification. Means the coarse particle, undigested particle at float at the top, a clear fluid will be there at the middle, and then fine digested particle will form the sediment. But this doesn't happen in case of ruminal lactic acidosis. Even if you keep it for half an hour, 1 hour, 2 hours, I have seen up to 5 hours also, there is no sedimentation activity. Means it says that the rumen ecosystem has been destroyed, rumen ecosystem has been compromised to such a great extent that no more digestion is taking place in the room. So these are some of the simple tests which can be performed on rumen fluid to say that the animal is suffering from ruminal lactic acidosis. So here some of the photographs are there. These are, you can grade them. Every 12 hours I have collected over a period of time, and you can see how the color changes. So the green color changes to milky white within 12 hours. It changes about 8 hours, but 12 hours it becomes pink. You can see the change of color. And at one particular time, when you give the therapeutic treatment, you can see the change of color. And then after 90 to 120 hours, you can see that the rumen fluid assumes its normal color. After the assumption, means after therapeutic intervention, you can see the change. If you don't do anything, this rumen fluid remains like that and it kills the host. Okay. Here you can see the pH. I have used the digital pH meter, which is more accurate. So here you can see the pH of the rumen fluid is 5.5, and even if you can record up to 4.5 or 4. Okay, and if you don't have rumen this pH meter with you, even nowadays rumen fluid pH strips are available, and they are cheaper alternative also. But some variation. It has got a very long range. Okay, so there you can see, and you can see if it is ranging in the acidic range, you can say that it's a rumen lactic acid. If you have advanced laboratory support with you, even you can go for supportive assessment. This needs a good laboratory support where you can estimate the lactic acid in the rumen fluid, lactic acid in the blood. You can measure the bicarbonate, you can measure the glucose and liver enzymes. So if you have got a good laboratory support, you can always estimate these parameters also. The lactic acid, you will find a very high level of lactic acid. Bicarbonate will be very, very low. Normally 22 to 24 milliequivalent is the normal bicarbonate in the blood, which will drop down to 12 to 15 milliequivalent. Glucose, surprisingly, there is a hyperglycemia. Elevated glucose level is there because carbohydrate substrate is being used. Okay, so hyperglycemic response is a clear-cut indication of lactic acid. It is, of course, a supportive parameter. And liver enzymes, because the endotoxins and then absorbed lactic acid, it causes lot of pressure, liver dysfunction. Because of that, the liver also gets damaged. So you will always find elevated levels of liver enzymes, especially the SGOT and SGP. Even you can go for GGT also, but the more appropriate is SGOT and SGP. Among them, SGOT is more important in case of ruminants. SGPT is more specific, liver specific for monogastric. That when a case is presented to you, you have to categorize it. Whether the case is in peracute form, whether the case is in acute form, or the case is in subacute form. Because this will decide what kind of treatment you have to undertake. So peracute form is always a very serious clinical emergency. And how you say that the animal is suffering from peracute lactic acidosis? First and foremost thing is heart rate. Heart rate is always more than 120 beats per minute. Okay, normally it ranges between 55 to 65, maximum 70. Okay, not more than that. So the heart rate, which is 55 beats per minute in a normal animal, it goes up to 120 beats per minute. It is all because of the toxemia and lactic acid and the related change. And in 90% of the animal is recumbent, almost in lateral recumbency. It is not responsive to external stimuli. Okay, it is almost virtually, you can call it as on the deathbed. Okay, acute abdominal distension because of the fluid accumulation, and rumen fluid is always less than 5. So these 3 or 4 parameters you have to always keep it in mind to say that peracute ruminal acidosis is there, and then we will discuss in peracute ruminal acidosis what are the best possible therapeutic approaches. Well, when you say that the goat is suffering from, or sheep or goat is suffering from acute lactic acidosis, when the heart rate is ranging between 80 to 100 beats per minute, when you make the animal to stand, it is able to stand for a while, but it will always have a mild ataxia, loss of balance, and it tries to sit. Okay, but for certain period of time, the animal will be able to bear the body weight. So it says that acute stage of rumen lactic acidosis. Distension will be moderate, and rumen fluid will be between 5 to 6.5. 5 to 6.5. I cannot say 6.5, but 5 to 6. Between 5 to 6, the rumen fluid pH is there. So here you can call it as the case is suffering from acute ruminal acidosis, and here you can buy some time. You have a time to save the life of that. In peracute lactic acidosis, the case is almost on the deathbed, and you have to act very fast to save the life of that. Subacute, which is a mildest form of lactic acidosis, and probably it is because the case is presented early, or the carbohydrate substrate which is ingested by the animal, it is in a very, very low quantity. So slight elevation of heart rate is there. What we say is 55, it may be about 65, 70, 75, something like that. Partial anorexia, the animal is not totally anorectic, whereas there is a total anorexia in acute and peracute form. Okay, partial anorexia is there, mild abdominal distension is there, and pH is almost about 6, and but it is less than 6.5. Okay, less than 6.5, between 6. So this will be helpful for you in the field to say that whether the case is peracute, whether the case is acute or subacute. Then we will go for the therapeutic approach. What are the goals of treatment in case of lactic acidosis? There are 3-pronged approach, what we call it. Okay, and on 3 grounds you have to work to save the life of the animal. Okay, the first and foremost is the correction of pH. The second and foremost important is restoration of fluid and electrolyte balance. And the third and foremost important criteria of treatment of ruminal lactic acidosis is rejuvenation of rumen ecosystem. Because we have seen that lactic acidosis totally destroys the rumen ecosystem. And you have to bring back this rumen ecosystem to normal so that the digestion will take place and the animal will regain its normal. So that let us go to the next slide. First, peracute ruminal acidosis. When you say that the rumen, the case presented is in peracute form, there are 2 options. One is emergency rumenotomy. Let me tell to the field veterinarians that emergency rumenotomy, most of the times we say that the animal is recumbent and how to approach and how to do the rumenotomy. But we have performed. I was advisory committee member for one of the surgery students, and we have seen that even in recumbent position also the rumenotomy can be performed and you can save the life of the animal. Only thing is your approach should be faster one, and immediate you have to go for rumenotomy approach. In case if you don't opt for rumenotomy operation. The other alternative is evacuation of rumen contents. But for this, either you should have a handheld rumen fluid extraction pump, or I will suggest it should be a motorized rumen fluid extraction pump. Okay, so this is available for about 8 to 10,000 rupees, and I feel that it should be a part of every dispensary, because it comes to a rescue to the veterinarian in most of the emergency cases. Even in case of poisoning also, you can think of evacuating the rumen content. So the motorized rumen fluid extraction pump remains the same either for large animal or small animal. It has got a 0.5 HP motor, and then you need to have a specialized type of extraction, means the rumen probine, which can be inserted into the rumen, and it can be connected to this motorized extraction pump, and within no time you can remove the fluid. So what we are having in our OPD, it evacuates at least 1 to 1.5 liter fluid in and about 6 minutes time. Okay, 5 to 6 minutes time. So that much of rapidity is there, and most of the 0.5 HP motorized pumps, they are very much handy in as an alternative approach for. So evacuation of rumen contents is very, very important. Few people, they have, there are some reports are there. As soon as you put the what you can call as probang, the stomach tube into the rumen, because of the pressure, sometimes the contents gets evacuated, but they are in very small quantity. Okay, 500 ml or 300 ml will come on its own. Okay, but after that you need to attach it to a negative extraction pump, so that the larger quantity can be removed. So we say that, and I have seen, and I have personally evacuated almost 2 to 2.5 liters of fluid in a acute rumen acidosis cases. Around 2 liters, you can easily remove it within no time, and that will bring a lot of solace, lot of relief to the patient, because the abdominal distension is the one which is actually causing so much of respiratory compromise in ruminal acidosis cases. So please keep it in mind to save the case of acute ruminal acidosis. Either you have to go for emergency rumenotomy, evacuation of content, and then putting back a digestible fiber content into rumen and then closing the rumen. The other alternative is by putting the animal on a negative pressure motorized rumen fluid extraction pump, so that the contents can be removed and the distress of the animal can be relieved to great extent. Okay, then let us come down to the acute ruminal acidosis and subacute that can be managed with a three-pronged approach, what I am suggesting you. So first is the correction of pH. So correction of pH is important, because this pH will help the unwanted microorganisms to take upper hand and utilize the carbohydrate source. So as soon as possible, the antacids should be given to the animal by peroral route, so that the rumen pH comes back to the normal. Bufazone is also a good product, but specific antacid like sodium bicarbonate or magnesium hydroxide can be given to the animal which is suffering from ruminal lactic acidosis. 1 gram per kg body weight orally can be given every 12 hours, and try to monitor the pH. Once the pH goes beyond 6.5 and above, you can stop the use of antacids. Okay, till that time, every 12 hours, 1 gram of either sodium bicarbonate or magnesium hydroxide can be given orally to reduce the pH. Okay, intraruminal antibiotic also has been advised to check the growth of gram-positive organisms. Okay, any antibiotic which is having directly it can reduce the gram-positive population of organisms can be given intraruminally. Orally also it can be given. It can be injected directly into the rumen. Streptopenicillin is available very frequently in most of the dispensaries. So around 2.5 ml of diluted streptopenicillin can be directly injected into the rumen. Oxytetracycline tablets, which I have used during my postgraduate thesis, that also can be used at the rate of around 10 milligram per kg body weight. Orally, it can be given to suppress the growth of gram-positive. Then, to some extent, the distinction is also because of the gas. So, non-ionic surfactant like silica and dimethicone, glotocil like commercial preparation, can also be given orally to reduce the stable flow. Okay, or to break the stable growth so that the gas which is likely to be accumulated into rumen can also be reduced to great extent. Okay. So this is the first priority, that is correction of rumen fluid pH. Second and most important aspect of treatment of ruminal acidosis is the fluid and electrolyte balance. Okay, the fluid and electrolyte balance is a very tricky type of situation in case of lactic acidosis. Theoretically speaking, the best treatment approach for the ruminal lactic acidosis and the metabolic acidosis is giving isotonic sodium bicarbonate, which is 1.3%. This is the most ideal fluid of choice. But the problem with us is we do not have any market preparation which is having 1.3% of sodium bicarbonate. We always have a 7.5% sodium bicarbonate ampoules, which are available in 10 ml, 25 ml. Sometimes some of the pharmaceuticals even they make it in 50 ml ampoules also. So such availables are there, and most of times I have seen, and I have, when I have interacted with the field veterinarians, even they inject 7.5% of sodium bicarbonate intravenous, which is not at all advised because it will rapidly change the systemic bicarbonate as ratio, and it can be sometimes lethal also. So always it has to be given in an isotonic form, that is 1.3%. So a simple solution I will tell you: the base deficit multiplied by 0.3 and multiplied by body weight. This is the formula to calculate the base deficit. Base deficit is nothing but the bicarbonate. Okay, so bicarbonate, how much of bicarbonate to be supplemented? So what they say is, when the animal is suffering from about 8 to 10, more than 8% dehydration, there is a 15 milliequivalent deficit. 15 milliequivalent deficit means the normal bicarbonate level in the plasma is around 25 milliequivalent. It has dropped to 10 milliequivalent, and you have to compensate this 15 milliequivalent base deficit. So that 15 figure indicates the bicarbonate deficit multiplied by 0.3, which is the standard standard factor in the formula, and 30 is the body weight of the animal. So when you calculate 15 into 0.3 into 30, so 135 milliequivalent is required by a goat weighing about 30 kg. So simple commercial simple formula is 150 ml of commercial 7.5% sodium bicarbonate solution needs to be used in isotonic dextrose. Okay, I used to do this routinely, and I used to find it very practical. In case if you can do that, I always appreciate that you can always try it, and you can see that the difference by immediately changing the metabolic state of the animal. Okay, so 150 ml of commercial 7. Sodium bicarbonate solution to be suspended in about 450 ml of isotonic dextrose. I am again underlying this isotonic dextrose. Please do not choose normal saline. Normal saline is a chloride donor. Okay, it adds up to the acidosis or metabolic deficit and bicarbonate deficit. So that's why try to choose isotonic dextrose, that is 5% dextrose. So always try to mix it in 5% dextrose and can give intravenously. If you don't want to get up into this, the simple alternative is use lactated ringers or ringers lactate, which is commercially available in the market. And how much to give depending upon dehydration. Okay, so dehydration can be, you can calculate what is the percentage of dehydration depending upon the clinical features. Normally it will be ranging between 8 to 9%, and then you have to calculate the fluid deficit, and whatever fluid is required you can supplement in the form of lactated ringers or ringers lactate. Okay, so this also saves a lot of animals. But the problem in this is, in many cases of acute and peracute lactic acidosis, the liver function is compromised, and to convert the lactate into bicarbonate, it occurs only in liver. So compromised liver may not be able to convert entire lactate which you are giving parenterally into bicarbonate, and that's why it may not reverse the condition of bicarbonate deficit. So that's why in some of the cases you will find even in spite of giving lactated ringers, you will not be able to save the life of the animal. Okay, so my suggestion will be sodium bicarbonate in isotonic form can be given, and this is how it can be calculated. And for 30 kg goat, I have told you how much it can be diluted, and it can be given intravenously. Now, the third and foremost important part of treatment of ruminal lactic acidosis. You have to bring back the rumen ecosystem to normal. So how you can do that? So you have plenty of prebiotic and probiotic supplementation available in the market, which are rich in Saccharomyces, which are rich in lactobacillus and all. So these are all essential microflora, they say. So they add Saccharomyces is more and yeast. They are the more pre and probiotics than lactobacillus. But in human health, lactobacillus is also present in the prebiotic and probiotics oral supplementation. Okay, so that also can be given to improve the rumen ecosystem. The second, most of times I am finding in field veterinarians, because there is a ruminal atony. This try to understand the rumen atony in case of lactic acidosis is because of the histamine release. Okay, so because of the endotoxemia, the histamine release is there, and this release histamine, it suppresses the rumen contractions. Okay, so that's why rumen motility is lost. Okay, many a times field veterinarians try to give rumenotorics. Okay, rumenotorics, in my sense, it has got a controversial role, because in case of acute and peracute lactic acidosis, there is already a chemical rumenitis. There is damage to rumen mucosa, and so that's why sometimes this irritating rumenotorics, which contains potassium, antimony potassium tartrate and all, can irritate the rumen mucosa, and it can end up into a problem. So I suggest to wait for about 3 days before inducting rumenotorics in the treatment of ruminal acidosis. So my personal suggestion, always it is open for discussion. So what I have seen that the chemical rumenotorics can add up to chemical rumenitis in case of acute ruminal acidosis. Then the cheapest and the best way of rejuvenation of ecosystem is cud transplantation. So the cud has to be collected from a slaughtered goat, and then it can be brought to the hospital, and it can be administered at the rate of 10 ml per kg body weight. Okay, 10 ml per kg body weight means around 300 ml. 30 kg body weight, if you take it, 30 to 10 ml, it comes to 300 ml. Okay, so what care you have to take when cud transplantation? Whatever you get from the slaughterhouse, you please check the pH and microfloral content of the rumen. So it should be beneficial to the affected animal. So always you see that the pH is normal. There are microflora in the collected cud from the slaughterhouse, and advise the owner not to spend too much of time in transit. As soon as the cud is collected from the slaughterhouse, it should be brought to the wherever the cud transplantation is taken place, and as soon as possible, this cud should be transplanted. And I always advise the cud should be sieved in a cloth, so that the other fiber contents can be removed, and only a fluid part which is rich in microorganisms, which is rich in protozoa and gram-positive and gram-negative organisms, it will be much more beneficial. And sometimes this fiber content sometimes clog while giving orally. So better to pass it through the sieve or through a cloth, fine mesh cloth, so that only fluid part will come out, and it can be given at the rate of 10 ml per kg body. Okay, these are some of the things which you should try to keep it in mind. And supportive treatment in case of ruminal lactic acidosis is antihistamines. We have already understood the pathobiology of ruminal lactic acidosis. Histamine release is the major factor in ruminal stasis. So that's why antihistamines, they form a part of therapeutic approach for the ruminal acidosis. Parenteral calcium deficiency, low calcium levels are also have been reported during my PhD thesis. I have seen that there is a hypocalcemia, not to the clinical level, but there is a marginal hypocalcemia. And this calcium, if you supplement parenterally, intravenously, it will add up to improving the muscle tone as well as the rumen contraction. So I always advise the calcium should be given parenterally to support the cases of ruminal lactic acidosis. Then one most important thing which many of the veterinarians they forget to incorporate in the treatment component of ruminal lactic acidosis, thiamine. Thiamine, because there is a change in the microfloral content, thiamine is produced in the rumen. There are essential microorganisms in the rumen which produce thiamine, and that's how the thiamine is supplemented to a ruminant animal. So all of them, they are dead because of the change in pH. So thiamine supplementation helps in the reversal of ruminal lactic acidosis, and it should be given at the rate of 10 milligram per kg body weight. It has been well documented that this can also result into, they call it as third phalangeal rotation, isn't it? In case of large animals, they have reported. Okay, so that happens. So thiamine supplementation should be a part of your treatment in ruminal lactic acidosis. Now the problem, clinical problem is you don't have many commercial preparations which have got a good thiamine. So let us suppose you calculate for a 30 kg goat, you want to supplement thiamine at the rate of 10 milligram per kg body weight, isn't it? So 10 milligram into 30 means 300 milligrams of thiamine needs to be supplemented to a ruminal acidosis suspected goat. Now the commercial preparation, if you see, most of the commercial preparations, they contain 33.33 milligram per ml, or some of the preparations they have 50 milligram per ml. Okay, you may have to give in a large quantity. Instead of that, there are few preparations like Biplex Sport is there, human preparation is there. It has got 100 milligrams of thiamine per ml. Mind it. So this Biplex like preparation 3 ml is sufficient, which can be given intravenously also or intramuscular. Intravenously it is better because this thiamine plays an important role in utilization of accumulated lactate in the blood. Okay, lactate is again converted into glucose substrate in Krebs cycle under the influence of thiamine. Okay, so that's how the thiamine helps. So commercial preparations which are good or which are having a good concentration of thiamine should be selected. Otherwise, you may have to give a higher dose. For example, 50 milligram per ml, if it is there, you may have to give 6 to 8 ml of this commercial preparation. Whereas a commercial preparation having 100 milligram, you hardly need 3 ml of commercial preparation to be given by intravenous. Then, in case if you want to adopt, stall feeding is going on a higher pace rate in case of goat farming also. If you want your animals not to suffer with the ruminal lactic acidosis, you have to adapt them. So the grain diet, if you are incorporating, it should be in a increasing indent, isn't it? So that the animal gets adapted to it and it suddenly doesn't end up into ruminal lactic acidosis. Then we have seen, even we had a project also, prophylactic feeding of iono-4 antibiotic. We have used Monensin at the rate of 300 milligrams as a dose. 300 milligrams of Monensin, if it is supplemented orally, can suppress the, it is a probiotic as a matter of fact, iono-4 antibiotic, and it improves the propionate production in the rumen. So that's how it helps, and it can suppress the formation of lactate in the rumen. So Monensin or salinomycin can also be given orally as a prophylactic feeding to reduce the incidences of lactic acidosis on a commercial farm.